Okay, so I've been working a lot on diaphragmatic breathing with many of my patients recently. So I thought I'd make this short video just to outline some of the steps to help encourage that deep diaphragmatic breathing so you can reap the benefits in terms of your back pain. So please excuse the funny angle. I'm filming this video solo today with very limited equipment, but hopefully the message will still get through. In order to gain the benefits of diaphragmatic breathing, you need to reduce or minimize effort here in the upper chest when you take an inhalation and try and concentrate the airflow lower in the body into the lower lungs. So if I ask you to take a breath and the instinct is to come up with the chest, take what we call a shallow breath, that's likely going to be having a negative impact on your back pain symptoms. So what we want to do is concentrate the breath into the lower belly. So a lot of people find it useful to place their hands over their abdomen and take a nice deep breath into their belly. So, and out, and in, and out. So I wasn't cheating by looking at the recording, but hopefully what you would have seen then is a lot of movement down here and not very much movement up here in my sort of upper chest area. Now, if you're someone who struggles with this, and the reason I'm making this video is because a lot of my patients recently have been sort of struggling with this concept a little bit proprioceptively, there are a few tricks you can use to help encourage this. The one I like to try first is just to place one finger or two fingers into your sort of side abs here, sort of into this sort of area. Here, you don't have to dig in too far, but a little bit of resistance. And then just do a gentle cough. And what you find when you do that is your body just instinctively, naturally, subconsciously will start to get an engagement with this part of the body. It's almost impossible to cough without these muscles sort of almost kicking out against your fingers. Now, you can use this trick to start to bring a bit more awareness to that part of the body, which might help you to focus your breath lower into the diaphragm. So what you can do if you do struggle with this, you just do a couple of gentle coughs and then try a deep breath, also keeping your fingers pressed into the side of your abdomen. So cough and then breathe. And out. And in. And out. So that's one trick that can really help with a lot of people. Actually, I had quite a lot of success just this morning with two patients who were struggling with this concept of diaphragmatic breathing. So I really like that one. The other one that can work really, really well is to take a forced exhalation first and then just allow the natural inhalation to flow into the diaphragm. So this one can be a little bit more tricky because it's a bit more passive, but it can work very well for some people. So what you do is force an exhalation first. So get all the air out of your lungs. So out. So what you may have noticed then is if you really, really force the exhalation, it might take longer than you think. And then you just relax. What will often happen is your natural, proper diaphragmatic breathing mechanism might then just kick in and you'll have a natural, very efficient diaphragmatic breath without the sort of tension and guarding that is stopping you from being able to do that. I hope you found that useful. If you are interested in learning more about the relationship between breathing dysfunction and back pain, I have a video that discusses the relationship, which I'll link at the end of this one. If you are struggling with diaphragmatic breathing, please recognize it can take a little bit of time to make it instinctive and natural. Try those two tricks, the cough or the forced exhalation, and hopefully they'll help you develop a little bit more awareness of your lower abdomen to help you relax into efficient diaphragmatic breathing and help you manage your back pain.